are two very common drugs that are used. One is called Desmopressin and the other is called Oxybutynin. Desmopressin acts like the antidiuretic hormone I've mentioned in the past. The whole idea of this drug is to try and reduce the amount of urine that the kidneys are producing overnight. And it can be taken either as a tablet or slipped under the tongue as a little melt just before going to bed. It's started at a low dose, and if there's no benefit after a few weeks, then the dose can be increased to see if that helps. In general, desmopressin's a very safe drug to take. It doesn't cause very many side effects, but it's like all medications. There's a very small number of young people may complain of some nausea or vomiting or loss of concentration, amongst other things, whenever they're taking the desmopressin. And if you're worried about any new signs or symptoms that develop after your young person starts taking it, you should have a chat to your family doctor about it. If the young person who's taking desmopressin starts to have any vomiting or diarrhea, it's important that you don't give the desmopressin during this period of time, because that can cause problems with the fluid in the body and problems with the salts in the body. Oxybutynin is another very common medication that's used to try and help young people with bedwetting. And Oxybutynin acts like a relaxant for the bladder. It chills the bladder out. And it's mainly used to try and treat the overactive bladder that we see a lot in young people. And if that's present at night, that can cause the bladder to squeeze down and make the young person wet the bed. And again, it can be started at a low dose and the dose increased if there's no benefit to it. And again, it can cause problems such as nausea, vomiting, loss of concentration, change of mood. And again, if you're worried about any new symptoms that develop after the young person starts to take Oxybutynin, then it's worthwhile having a chat to your family doctor about this. Bedwetting is such a common problem in young people that NICE, the National Institute for Health and Care Excellence, have developed a guideline which should be used nationally. So it doesn't matter if you go to see your family doctor in London or somebody in the north of the country, they should be able to follow these guidelines. And NICE suggests that you can try either the desmopressin or the Oxybutynin as the first line treatment. If the drug that you're given doesn't work, you should then try the other drug. So if you've tried desmopressin and that hasn't worked, you should try Oxybutynin, and vice versa. And if you find that desmopressin and Oxybutynin on their own have both failed, then the next step is a trial of both drugs together. If desmopressin and Oxybutynin together don't work, then there is another drug called Imipramine that can be used to try and help bedwetting. But by the time that you're getting on to the using Imipramine, it doesn't have a high success rate, but it does work in some young people. And if you warrant trying Imipramine, your doctor will discuss this with you.